Realize.
Okay. नमस्कार, ग्रीटिंग्स फ्रॉम HCFI। मैं कृष्ण चावला, आपका दोस्त और आज के कार्यक्रम का होस्ट। आज के इस नॉन स्टॉप 86 सेशन में स्वागत करता हूं। मैं स्वागत करता हूं अपने सभी देखने सुनने वालों का, सभी टेक्सटाइल एसोसिएशन के मेंबर्स का, मार्केट एसोसिएशंस का, NGOs का और RWS का। उसके साथ साथ आज का स्पेशल सेशन, उसमें मैं अपने सभी हेल्थ एजुकेटर फैमिली का भी स्वागत करता हूं। आज का ये सेशन रहेगा बाय डॉक्टर अंजलि अग्रवाल, रोल ऑफ पेल्विक फ्लोर एंड सेफ एक्सरसाइजेस टू बेटर वुमेन्स हेल्थ ओवर 30। उससे पहले कि हम सेशन की जो फॉर्मल शुरुआत करें, मैं डॉक्टर कालरा, डायरेक्टर HCFI से रिक्वेस्ट करूंगा कि हेल्थ के विषय में और कोविड-19 के विषय में अपडेट दें। ओवर टू यू डॉक्टर कालरा, आपका स्वागत है।
धन्यवाद चावला जी। मैं सब पार्टिसिपेंट्स का इस HCFI के सेशन में स्वागत करता हूं और सबको नमस्कार। जैसा कि आप सभी जानते हैं, जो हम पिछले महीने 2 महीनों से बार बार हम चर्चा कर रहे थे कि थर्ड वेव से कैसे बचा जाए, आएगी या नहीं आएगी, सबको डाउट था। फिर हमने देखा कि इसी महीने नया जो वेरिएंट ऑफ कंसर्न कोविड का ओमिक्रॉन, वो रिपोर्ट हुआ इंडिया में। और देखते देखते विद इन 3 वीक्स हम आप सब जानते हैं कि कितना जल्दी से फ्रॉम 1 से अब जो है कल तक, अर्ली मॉर्निंग आज तक का 781 केसेस ओमिक्रॉन के इंडिया में रिपोर्ट हो चुके हैं 21 स्टेट्स के अंदर। तो आप सब जानते हैं कि कितनी तेजी से ये जो है फैल रहा है। तो डेफिनेटली इस लुक्स लाइक अगर हमने अभी भी अपनी कमर नहीं कसी, तैयारी जो है जो हमें करना चाहिए नहीं किया, तो थर्ड वेव तो शुरुआत हो चुकी है। हम हर हालत में हमें इसे कंट्रोल करना है। अभी भी ये हमारे हाथ में है कि हम इस जो अब ये वेव आई है, एकदम केसेस बढ़ने शुरू हुए हैं 3 हफ्तों से, 4 हफ्ते, अब तो महीना होने वाला है लगभग। इसको आगे ना बढ़ने दें। वैसे देखें तो पूरे देश में हम देखें कि इंडिया में पिछले 24 घंटों में 9,195, जबकि पिछले एक दिन पहले देखें तो उससे कंपेयर करें तो 40% ये इंक्रीज हुआ है न्यू केसेस में। महाराष्ट्र में भी जो केसेस बढ़ रहे थे फिर दोबारा बढ़ने शुरू हुए। उसमें महाराष्ट्र से लास्ट 24 आवर्स में 2,172 और 22 डेथ। केरला में 2,474 न्यू केसेस। कर्नाटका में भी 356, तमिलनाडु में भी 619 और वेस्ट बंगाल में भी 752 केसेस। दिल्ली में देखिए, जहां सिर्फ 49-50 पे आ गया था इतने दिन से, अब देखें दिल्ली में लास्ट 24 आवर्स में 496 केस रिपोर्ट हुए हैं और एक डेथ भी हुई है, जो इतने दिनों से कोई दिल्ली में डेथ नहीं थी, 3-4 दिनों से। तो कल एक डेथ भी रिपोर्ट हुई है। और गुजरात में भी जो है केसेस 394 और एक डेथ। तो ये जो केसेस दोबारा बढ़ने शुरू हुए हैं हमारे देश में, ये ओमिक्रॉन की वजह से, क्योंकि जो पहले ही शुरू में मैंने बताया जैसे ओमिक्रॉन बड़ी तेजी से ये फैल रहा है और 1 महीने से कम समय में या ये हमारे देश के 19 अब तो आज तो ये 21 स्टेट्स और यूनियन टेरिटरीज में रिपोर्ट हो चुका है। दिल्ली में सबसे ज्यादा, इसलिए दिल्ली में 496 केसेस जो हैं, दिल्ली में ओमिक्रॉन के 238 हाईएस्ट इन इंडिया। उसके बाद महाराष्ट्र, फिर गुजरात, महाराष्ट्र में भी 167 केसेस। तो ये जो है ट्रेंड जो एकदम जो कंट्रोल में सब कुछ स्थिति लग रही थी पिछले महीने, उसके बाद जो ये अब देख रहे हैं, ये डेफिनेटली ओमिक्रॉन जो नया वायरस वेरिएंट का ऑफ कंसर्न, पहले ही जानते हैं हम कि इसकी ट्रांसमिशन कैपेबिलिटी बहुत ज्यादा अधिक है, लगभग 8 times than the original and 3 times than the delta। तो हमें जो है अब गवर्नमेंट ने भी कुछ नए एक्शन, आप सब लोग जानते हैं, अभी 3-4 दिन पहले ही गवर्नमेंट ने भी एक मेजर्स, अब नए एक्शंस जो हैं वो शुरू किए हैं। ये ओमिक्रॉन का जो भय देखते हुए, जो इतने दिनों से हम वेट कर रहे थे बूस्टर डोज की, खासकर की फ्रंट लाइन वर्कर्स, हेल्थ केयर वर्कर्स और एल्डरली के लिए, हम बड़ी ईगरली मतलब वेट कर रहे थे कि बूस्टर डोज की गाइडलाइंस कब आएंगी और बच्चों का वैक्सीनेशन कब शुरू होगा। तो गवर्नमेंट ने अब, आप सब पढ़ चुके होंगे मीडिया में कि अब गाइडलाइंस इशू कर दी हैं कि 3 जनवरी से बच्चों का टीकाकरण 15 से 18 साल की उम्र में, और जो हेल्थ केयर वर्कर्स हैं, फ्रंटलाइन स्टाफ, हेल्थ केयर वर्कर्स और कोमॉर्बिड जिनको एल्डरली बुजुर्ग लोगों को है, उनका भी 11 जनवरी से जो है 10 या 11 की डेट है से बूस्टर डोज जो है शुरू हो जाएगा। उसका भी पूरा गाइडलाइंस आ चुकी हैं कि जिसके भी 9 महीने या 39 वीक्स सेकेंड डोज के कंप्लीशन के बाद हो चुका है, ऑटोमेटिकली उनको मैसेज आएगा कि अब ये जो डोज, प्रोटेक्टिव डोज और गवर्नमेंट ने दी है, वो उनको मैसेज आ जाएगा और वो सब जाके सेंटर्स पे लगवा सकते हैं। अब इसके विषय में अभी क्लैरिटी गाइडलाइंस में भी नहीं है कि कौन सी वैक्सीन लगेगी। ऑल ओवर द वर्ल्ड लगभग मोर देन 35 कंट्रीज में जो बूस्टर डोज लग रहा है, जो हम पहले भी बात करते रहे हैं कि मिक्स एंड मैच, उससे जो है प्रोटेक्शन जो है ज्यादा बेहतर रहती है। पर अभी जो रिसेंट ये गाइडलाइंस हमारे गवर्नमेंट की जो है आई है, उसमें इसके बारे में कोई जिक्र नहीं है। तो अभी तक जो इंटरप्रिटेशन तो यही है कि जो डोज आपको पहले लगी हुई है उसी की लगेंगी। अगर कोवैक्सीन किसी ने लगवाई हुई है दोनों खुराकें, तो 3rd डोज जो ये है उसको वैक्सीन की ही, और ऐसे ही कोविशील्ड, अगर किसी को कोविशील्ड की लगी हुई है तो अब ये बूस्टर डोज जो है एडिशनल डोज ये उसी की लगेगी। हो सकता है आने वाले समय में ये क्लैरिफिकेशन आ जाए, उसके बारे में अभी कुछ नहीं कह सकते हैं। पर ये जरूरी है कि हम अब देखें, इसके साथ ही जो मैं एक शेयर करूंगा स्लाइड, ये जो वैक्सीन्स, बूस्टर डोज और बच्चों का वैक्सीनेशन की गाइडलाइंस के अलावा जो रिसेंटली ये 2 दिन पहले ही जो हमारे देश में 2 नई वैक्सीन्स कोवावैक्स और कॉर्बेवैक्स और एक दवाई जो कि ओरल गोली है, टैबलेट फॉर्म में है, मोलनुपिराविर, ये भी जो है DCGI ने अप्रूवल हमारे देश में दे दी है। DCGI हाईएस्ट अथॉरिटी है हमारे देश में अंडर मिनिस्ट्री ऑफ हेल्थ टू अप्रूव न्यू वैक्सीन्स और ड्रग्स। तो जो दवाइयां पहले इमरजेंसी अथॉराइजेशन यूज जैसे रेमडेसिविर था, टोसिलिजुमेब था, अप्रूव हुई थी, ऐसे ही ये दवाई जो है मोलनुपिराविर जो है, ये भी जो है अब ट्रीटमेंट जो नॉन हॉस्पिटलाइज्ड पेशेंट्स हैं, अगर अर्ली डिसीज, अर्ली जल्दी ही जो है सिम्टम आने के बाद, डायग्नोसिस के बाद इसका इस्तेमाल किया जाए, तो ये दवाई जो है वायरस का जो रेप्लिकेशन हमारी बॉडी में होता है उसको ये रोकती है। जो वायरस का हमारे शरीर में रेप्लिकेशन ही नहीं, मल्टीप्लाई ही नहीं कर पाएगा, तो उससे जो है गंभीरता जो है बीमारी की वो बहुत कम हो जाएगी। तो ये जब देखा गया कि इसकी एफिकेसी 30% है इन अनवैक्सीनेटेड इंडिविजुअल्स। तो ये दवाई पिछले महीने सबसे पहले यूके में अलाउ इसका परमिशन मिला था, तो यूएस में ये चल रही थी, अब जो है हमारे देश में भी इसका अप्रूवल आ गया है। ये दवाई जो है एंटीवायरल, स्पेसिफिक एंटीवायरल, पहले ये कोई एकदम नई नहीं है, पहले इसका इन्फ्लुएंजा बीमारी के लिए इसका अप्रूवल आया था। तो अब इसको, उसी दवाई को अब जो है कोविड के लिए भी इसके जो ट्रायल्स आए, एफिकेसी इसकी देखी गई, ये इफेक्टिव है। और ये कोवावैक्स और कॉर्बेवैक्स जो 2 नई दवाइयां हैं, कोवावैक्स जो नोवावैक्स कंपनी है उनकी है, और इंडिया में ये सीरम इंस्टीट्यूट जो हमारा, जिनमें कोविशील्ड बन रही है, वही सीरम इंस्टीट्यूट इसको हमारे देश में कोवावैक्स वैक्सीन को बनाएगा। और कॉर्बेवैक्स जो है ये भी जो है हमारे देश में, ये तो जो बायोलॉजिकल ई कंपनी है इंडियन मार्केट में, ये भी जो है, जैसे हमारी 2 वैक्सीन जो इंडिजीनियस हमारे भारत में ही बनी है, तो ये भी पूरा इंडिजीनियस हमारे भारत में ही बनी है, कॉर्बेवैक्स। ये दोनों वैक्सीन जो कोविड वायरस का प्रोटीन होता है, ये उसको जो है प्रोटीन को लेके जो है ये वैक्सीन और उसके कंपोनेंट्स को लेके बनाई गई है, ताकि हमारे शरीर में जब ये वैक्सीन जाएगी और जो कोविड जो है वायरस मेन एस जो स्पाइक प्रोटीन है वो बड़ी महत्वपूर्ण है, उसी के अगेंस्ट जो है ये सारी इम्यूनिटी डेवलप होती है। जो हमारा इम्यून रिएक्शन बॉडी का होता है वो स्पाइक प्रोटीन के अगेंस्ट है। तो ये स्पाइक प्रोटीन्स के ही पार्ट्स को लेके ये कोवावैक्स और कॉर्बेवैक्स दोनों जो है उस, इनकी थोड़ा सा मैकेनिज्म डिफरेंट है, पर ये एक्शन उस तरह से ही करती हैं। अगर डिटेल में जाना चाहें तो आप देख सकते हैं कि एक दवाई जो बनी है वो ये जो है स्टेप 1 कोवावैक्स जो है, इसमें जेनेटिक कोड जो होता है प्रोटीन का उसको रीड करके ये जो है एक डिफरेंट टाइप्स ऑफ सेल्स, जिसके अंदर की जैसे मॉथ सेल्स हैं या यीस्ट सेल्स हैं, उनके अंदर इस पार्टिकल को फर्दर जो है डेवलप किया जाता है आर्टिफिशियली। और फिर जो है ये जो दवाई है, जो नए वैक्सीन्स है, एस प्रोटीन का जो पार्ट है, ये हमारे शरीर में जब इसको इंजेक्ट किया जाता है तो वो हमारा शरीर वैसे ही रिएक्ट करता है जैसे कि कोविड-19 का जो वायरस आता है उसकी स्पाइक प्रोटीन होती है, उसको जो ये फॉरेन बॉडी समझ के जो एक्शन आता है, सेम एक्शन जो है ये इन दोनों प्रोटीन के इस्तेमाल से हमारे शरीर में रिएक्शंस वो पैदा, एंटीबॉडीज बनेंगी। और मोलनुपिरेविर जो गोली है, दवाई जो है, वो भी जो है जब हम कोई दवाई लेंगे तो हमारे शरीर के अंदर जो रेप्लिकेशन प्रोसेस है, जो उसको जाके ये टारगेट इसका ये होता है कि लाइक रेमडेसिविर मिमिक सम ऑफ द बिल्डिंग ब्लॉक्स ऑफ द आरएनए, और ये जो है उसका असर करती है कि उसका जो कोड होता है, जो मल्टीप्लिकेशन का जो कोड होता है, उसमें एरर लाती है। जब मल्टीप्लिकेशन के प्रोसेस में ही एरर प्रोड्यूस हो जाएगा, जो वायरस है वो फिर रेप्लिकेट नहीं कर सकता, मल्टीप्लाई नहीं कर सकता। उस ढंग से जो है ये दवाई काम करेगी। तो ये ओमिक्रॉन का असर देखते हुए और जो हमारे देश में स्थिति, खासकर दिल्ली का मॉडल देखें, दिल्ली में जो इस टाइम मैक्सिमम केसेस आए हुए हैं कोविड के लास्ट 24 आवर्स में, और कुछ दिनों से इसका नंबर बढ़ता जा रहा है, जिसकी वजह से जो इन्फेक्टिविटी रेट जो हम पिछले हफ्ते देखी थी वो बढ़ के अब आज की डेट में 0.89% हो गई है। जब इतने ज्यादा पॉजिटिविटी रेट जब हो गया तो जो हमारा एक जो प्रोटेक्शन प्लान बना हुआ था, रिस्पांस प्लान जो बना हुआ था, डिजास्टर मैनेजमेंट जो कमेटी है उनका जो प्लान बना हुआ था, वो अगर 0.5 से देखें, ये येलो अलर्ट, एम्बर एंड ऑरेंज, जब भी 0.5% से अधिक हो जाएगा इन्फेक्टिविटी रेट, पॉजिटिविटी रेट, तो ऑटोमेटिकली उस स्टेट के अंदर, खासकर दिल्ली ने इस को माना, और जो है उन्होंने, आप सब जानते हैं, कल से ऑलमोस्ट सेमी लॉकडाउन दिल्ली स्टेट में हो चुका है। अभी जो है वो लेस देन 1% है पॉजिटिविटी रेट, इसलिए येलो अलर्ट घोषित किया गया है। और उसके अंतर्गत सभी शॉप्स जो हैं एसेंशियल वाली जो हैं वो तो अलाउड है, और बाकी शॉप जो नॉन एसेंशियल हैं वो ऑड इवन के तरीके पे, मार्केट्स जो हैं वो शॉप्स वैसे ही खुलेंगी ऑड एंड इवन के तरीके से। ऐसे ही मॉल्स, प्राइवेट अटेंडेंस, ऑफिस में 50% अटेंडेंस, एजुकेशनल इंस्टीट्यूट, सारे स्कूल, कॉलेजेस, कोचिंग, सब सेंटर बंद कर दिए गए हैं। रेस्टोरेंट्स में भी 50% कैपेसिटी पे ही अलाउ किया गया है। ऐसे ही बाकी अदर सिनेमा हॉल क्लोज्ड हैं, सैलून्स जो है सर अलाउड हैं। तो डिपेंड अपॉन जो पहले ये प्लान बना था, जिसके हिसाब से जो स्थिति आएगी उस हिसाब से ये प्लान जो है, इवन पब्लिक ट्रांसपोर्ट, मेट्रो में भी जो है आज की डेट में मैक्सिमम 50% सीटिंग कैपेसिटी अलाउड है एंड नो स्टैंडिंग। नाइट कर्फ्यू 10 PM फ्रॉम 10 PM टू 5 AM ये ऑलरेडी इन्फोर्स्ड है। तो इस चीज को देखते हुए हम सब जानते हैं कि हमें जो है सबको मिलके इस टाइम बहुत ही आवश्यक है, कोऑपरेट करना है, कि गवर्नमेंट के एफर्ट्स के साथ साथ हम सब लोग मिलके कोलैबोरेट करें और कोविड एप्रोप्रिएट बिहेवियर और वैक्सीनेशन, जिसका वैक्सीनेशन हम सब जानते हैं कि अब तक भारतवर्ष में ऑलमोस्ट 90% ऑफ द एलिजिबल पॉपुलेशन में मिनिमम फर्स्ट डोज लग चुकी है, और ऑलमोस्ट 62% में तो दोनों डोज खुराक जो है एलिजिबल पॉपुलेशन में अब लोगों को लग चुकी है। बाकी जो बचे हुए हैं तो ये बहुत जरूरी हो जाता है कि सब लोग आगे आए और वैक्सीनेशन अपना लगवाएं। और फर्दर जिनको दोनों डोज लग चुकी हैं, जो एलिजिबल है एज पर गवर्नमेंट गाइडलाइंस, वो जो है जैसे ही थर्ड डोज का उनको मैसेज आता है, या आप खुद भी जाके सेंटर पे जाके ऑन साइट जो भी कोविड वैक्सीन के सेंटर्स हैं उनमें जाके रजिस्ट्रेशन कर सकते हैं अंडर कोविन ऐप, जैसे कि पहले किया था सेम उसमें आप जो है 10 तारीख के बाद जाके अपना वैक्सीनेशन करवा सकते हैं। पहले गाइडलाइंस में आया था कि बूस्टर डोज के लिए जो एल्डरली पॉपुलेशन है, जो बुजुर्ग लोग हैं कोमॉर्बिड, उनको एक डॉक्टरी सर्टिफिकेट चाहिए होगा। अब उसके बाद क्लियर मीडिया में क्लैरिफिकेशन आ गया है कि वो जो है प्रिस्क्रिप्शन की जरूरत, अब सर्टिफिकेट की जरूरत नहीं है। अपना आप सिर्फ जो है आधार कार्ड या जो भी आईडी प्रूफ लेके जाते हैं, अपना एज दिखा के आप अपना टीकाकरण जो है अगर कोमॉर्बिडिटीज आपको हैं आप करवा सकते हैं। तो ये बहुत जरूरी है कि अब जो है आप सबका ये मैसेजेस फर्दर पर्कुलेट करें, लोगों को समझाएं कि पूरी सावधानियां, घर से बाहर कम से कम निकलें, और बाहर जाना भी पड़ता है किसी वजह से तो आपको डबल मास्क लगा के ही जाएं। इतना और समय मैं नहीं लूंगा, मेन टॉपिक अब अंजलि जी को करना है। ओवर टू चावला जी।
थैंक यू। हाँ जी, अनम्यूट माय सेल्फ। नमस्कार डॉक्टर कालरा और थैंक यू और वेलकम डॉक्टर अंजलि। आप सभी को मालूम है कि 2 हफ्ते पहले हमने एक सेशन किया था। वो जो सेशन लिया गया था डॉक्टर अनीता थर, उन्होंने बात की थी लाइफस्टाइल मॉडिफिकेशंस ड्यूरिंग एंड आफ्टर मीनोपॉज, और उसमें मीनोपॉज के दौरान होने वाली तकलीफें, इरेगुलर पीरियड्स, वेजिनल ड्राइनेस, हॉट फ्लैशेस, चिल्स, नाइट स्वेट्स, ऑस्टोपोरोसिस, यूरिन इनकंटिनेंसीज, ये उसके रिजल्ट थे। उन पर जो मेडिकल पार्ट था, जो दवाइयां और जो हमें लेनी चाहिए और जो मेडिकल कंसल्ट कब कब करना चाहिए कि डॉक्टर से क्या क्या सलाह करनी चाहिए, उसके विषय में उन्होंने जानकारी दी थी। उसका सेकंड पार्ट था कि इस दौरान बल्कि विमेंस को अर्ली 30s से ही क्या क्या एक्सरसाइजेस करनी चाहिए, अपने लाइफस्टाइल को किस तरह से मॉडिफाई करना चाहिए, कौन कौन सी एक्सरसाइजेस करनी चाहिए ताकि आप स्वस्थ बने रहें और इन बीमारियों से समय रहते अपने आप को बचाव कर सकें। उसके लिए हमने रिक्वेस्ट की है डॉक्टर अंजलि अग्रवाल से, जो हमारी फैमिली की मेंबर है, कि आज का सेशन वो इस पर लें। आप सभी जानते ही हैं कि डॉक्टर अंजलि अग्रवाल इज ए कंसल्टेंट फिजियोथेरेपिस्ट और काफी टाइम से हमारे ऊपर साथ जुड़ी हुई हैं और काफी सेशन ले चुकी हैं। तो अब मेरे ख्याल से जरूरत नहीं है कि मैं सारी डिटेल्स उनकी पढूं। तो समय के अभाव और समय को बचाने के लिए ज्यादा देर मैं आपके और डॉक्टर अंजलि के बीच में ना रहना चाहता हूं, और मैं डॉक्टर अंजलि को रिक्वेस्ट कर रहा हूं कि आए और आज का सेशन लें। ओवर टू यू डॉक्टर अंजलि, यू आर वेलकम।
Thank you, Chawlaji, and thank you, Heart Care Foundation, and a lot of greetings to all of you on the next coming New Year too, because up to next year mein milenge. And let's start the session. It's a very important session considering women's health, and all the women who are over 30 and also above 40 and 50 should be taking into consideration of whatever points I'll be mentioning today in my session. I'll just share my PPT. Yeah. So what is the role of pelvic floor and safe exercises for better women health over 30 is the topic which I'll be talking. It's a very different topic apart from what we usually see as women's health. And sometimes we are not aware of the important bits and pieces of pelvic floor. We all know that as a human body, we have a lot of muscles, we have a lot of bones, हमारे अंदर बहुत सारे organs हैं, but एक term जो हम लोग सब भूल जाते हैं, we are very taboo to talk about, is the pelvic floor. But this is a very important muscle which is actually supporting, holding most of the organs of the body from the below side of the pelvic. हमारे जितने internal organs होते हैं उनको ये support करती हैं ये muscles. So how it plays a very important role for women's health we will talk and shed some light on this topic. Dr. Chawla has already introduced me. So let me start with the chapter of exercise. So we all have to be physically literate to start our day with exercises, which will help us build up more muscle strength and bone health as a woman. And that is my motto, to advocate physical literacy among all the women here. Let's take women's health as a picture in general. This is very important because we know that we grow up as a small girl which reaches a period menarche. That's the time again a body of changes in body happens. Then comes a phase where the women comes into a reproductive age where a lot of issues with pregnancies and postpartum can come and show up. And then it's the last phase when a woman undergoes the menopause. I have put this lady inside the refrigerator because she is representing a woman who has a lot of issues with hormones, hot flushes, and various kind of factors which is being linked to menopause. So the women feels really hot sometimes and feels cold. There's a lot of temperature changes and mood fluctuations, anger issues, and lot of depression, anxiety issue which a woman suffers from menopause. So in सबको देखते हुए, what are the things which we can do apart from eating well, sleeping well, thinking well? There's a lot of exercises which we all should be inculcating in our daily workouts and making sure that a fitter 30 becomes a smarter 40 and a happier 50. That's what the motto is. So let's visualize. Puberty, as all I have said, it's the growth spurt time. The body image of a woman is changing. Then comes the pregnancy phase, which is also dominated by physical, emotional, mental changes and changes in the body dynamics. The weight-bearing capacity of the spine and the posture of the women changes because of the high arched back or the lordosis. Pregnancy के कारण ये सारे effect हमारे postnatal period में भी जाते हैं, where the women has we never talked about the postpartum period. A woman is visiting the hospital or the gynec for a lot of prenatal visits, but postpartum पे ज़्यादा encouragement नहीं मिलता है checkups में, and that is also causing a lot of issues for women post 30, which could be linked with not so good labor or having birth traumas that not been addressed, because of which women developed a lot of postpartum complications post the 30 years of age. And then we miss a picture between postpartum and the menopause, could be the perimenopausal phase and also the premenopausal phase, which is missed. And when we always hear for the women is that she's got all cranky and we blame it on the hormones and we blame that the women is all having pains in the body, but we never look at why she's having pain. There's a lot of changes that the body has undergone. So let's work with the times and how we can realign the body as per her hormonal phase and her growth spurt. Now, another thing which I have to bring the topic is post 30, we see a lot of women with painful periods too. और ये सारी women को हम लोग बोलते हैं ये bad period समझ के भूल जाओ. But what we forget is there's a term called endometriosis. इनमें काफी सारी painful, heavy bleeding, menstrual cramps होते हैं, and they might have issues with rapid heart rate and fluctuating blood pressure, elevated reduced body temperature, and abnormal heart blood levels of reproductive hormones. तो इनमें काफी सारे टाइम हम लोग को estrogen dominance दिखता है endometriosis cases में, and spotting between periods can also be linked with endometriosis. These are the common complaints we see in women post 30 years of age. They also have issues with conceiving post the 30 years, and we see a lot of women having these issues because of a lot of the pelvic floor issues, which might lead into endometriosis and other issues. Post 30 के time पे काफी सारी women जो deliver भी कर चुकी हैं, they are also now getting into a phase of PCOS. Now PCOS is a lifestyle disease, and I am bringing this topic as important because about 40% of the women I see now post 30 and 35 to 40 now have PCO symptoms, and they're not able to understand because they have delivered the baby, because the common link of PCOS is that infertility, or we're not able to conceive. But we forget that PCOS is the precursor for pre-diabetic situation and women turning diabetic and having lot of issues with weaker bones and osteoporosis. So itne sare issues which are hormonally linked for a women are also linked with age post 30. Now, the thing is, post 30 to 40 is the time when women is more, realizing that she has to look thinner. But what we want is a good thinner, a healthy thinner than an unhealthy thinner. Crash diets and crash ways to do workouts in the gym has caused a pandemic of women with issues with pelvic floor disorders, pelvic floor dysfunction, जहाँ पे इनका pelvic floor बहुत weak or damage हो जा रहा है. So I will shed light on what is the right way a woman should look after her pelvic floor health post her 30 year of age. Now, again, a childhood obesity is a prime factor. A woman puts on more weight around the age of 30 and 40. So a vicious cycle of childhood obesity is also causing a lot of bad impact on the pelvic floor and the muscular strength of a woman. So a kind word of advice to everybody is that if childhood may women or the girls are looked after well, they are made not sedentary but very active, they'll have a very good pelvic floor as they grow up at the age of 30. Now let's understand what is pelvic floor. What is the function of pelvic floor? So pelvic floor, जैसे floor बोलते हैं, it's like a muscle which extends from a tailbone. Tailbone is called as the sit bone. हम लोग जिस पे बैठते हैं, and the pubic bone, it forms a platform in between the legs. It's like a hammock. It's like a jhula. And it is holding all the internal organs for a woman and a man. So pelvic floor ka matlab ye nahi is just for the women, it's there for men and women both. But today we're talking more in light in terms of women. Now, this provides the floor to the pelvis and it's supporting your bladder, the uterus and the back passages or the anus. And at the openings, this falling through the urethra, the tube which the urine is passing, from the vagina, from where the birth canal or the birthing is happening, and the anus, which is the back passage through which we empty our bowels or open our bowels. So this is the entire range of pelvic muscles or the floor. ये सारे organs हमारे कई सारी छोटी छोटी muscles से supported होती हैं, and they play a very vital role in helping us do very vital bowel movements, urinary bladder issues. ये सारे issues pelvic floor के कारण भी आते हैं. Now, if we look at a rough picture, a rough diagram, so we never say that pelvic floor works alone. हमारी जो pelvic floor होती है, it works on various concepts of the muscle strength. So we have a muscle called the diaphragm. Then we have a muscle which is called the front muscle, which is called transverse abdominis, the back muscle, which is called the multifidus, and the sacrum, and the pubic bone, and the pelvic floor. They all work in sync to support and function the pelvic floor in a healthy manner. तो कई बार जब हम बोलते हैं women को deliver करने के लिए, normally we ask them to breathe very deeply and to relax the pelvic floor for the outlet of the baby. So all these muscles will come into function when a woman is delivering. The same principle is applied when a person or a woman goes for opening the bowels, और जब वो अपने constipation हो जाता है उन्हें, तो ये सारी muscles में problems एक साथ आती हैं. That's why the woman is not able to defecate, or she's not able to open the bowels well, despite having taken any kind of a constipation curing pills. She's taken a lot of pills to help her with constipation, but कोई असर नहीं दिख रहा है. तो we have to think that हो सकता है pelvic floor में issues आ रहा है because of as she's aging, her hormones called progesterone, estrogen में imbalances हो रहे हैं. That can cause to menopausal linked constipation, endometriosis linked constipation, or because of a dysfunctional pelvic floor. What are the symptoms of a weak pelvic floor? कैसे women को पता चलेगा कि उनकी pelvic floor weak है? जब भी किसी women को लग रहा है कि there's a achy dragging feeling in the pelvic area, ऐसे लग रहा है खिंचाव जैसा, कुछ गिर जा रहा है, कुछ बहुत ज्यादा पेन आ रहा है उन्हें, And if they're feeling that there's something coming down from their vagina, and they might feel that there's a prolapse symptoms, or their organs in the pelvis or the womb might just drop off if she stands up for a second, if she's standing in the kitchen or she's walking in the playground for long hours, she might feel that there's a feeling of heaviness in the pelvic. The tendency to leak urine, cough, laugh, and sneeze is also called as the stress urinating continence. So जैसे cough हुआ, जैसे sneeze हुआ, the women might feel कि मेरी urine leak हो जा रही है. So these are all coming under the category of stress urine continence. Women को हमेशा लगता है कि बार-बार वो टॉयलेट जाएं. तो जैसे वो लोग सपोज बाहर से आए, मॉल से आए, उनको लगता है कि जैसे दरवाजा उन्होंने खोला तो उनको लगता है चलो वॉशरूम भागते हैं. So that is also caused as an urge incontinence. And it can happen all throughout the day and the night. Many times women over 35, they always complain to me
Please mute
that in a
yourself.
day they get up like.
एक मिनट डॉक्टर अंजलि, प्लीज म्यूट योरसेल्फ. रितु सबको म्यूट कर दो और डॉक्टर अंजलि को अनम्यूट कर दो. सबको म्यूट कर दो प्लीज. Thank you.
Yeah. Okay. Now, the urgent need to visit the toilet and leaking before you get there is called urge incontinence. So, कई सारे times हमें menopause के time में कई सारी women over 45 to 50 में ये बोलती हैं कि मैं वॉशरूम जा रही थी, उसके पहले ही मेरी यूरिन लीक हो गई है और मैं बाथरूम में पहुंची ही नहीं है, and then this has happened. So it is not something which women should feel embarrassed about. They should talk to people like us, and there's help available. And इसको help करने से ही आपकी overall health will be good. And inability to pass the wind from the back passage. तो कई सारी women बोलती हैं, I feel very bloated in my tummy. बहुत सारा gassy feeling होती है. I'm not able to, pass the gas from behind because कई बार ये weakened pelvic floor के कारण ये सारी असर दिखते हैं. And many times these women also say that उनका जो टॉयलेट में बॉयल ओपनिंग है वो बार-बार जाना पड़ रहा है उन्हें. उन्हें लगता है कि एक बार गए हैं और कई बार लगता है कि वो लीक हो जा रहा है. So there's a fecal incontinence. So these are all linked with a very weak pelvic floor. Sometimes it could be because of a hypertonic pelvic floor. So we will not just say that the pelvic floor is weak. The pelvic floor can be tight, and about 30 to 40% of my women patients, they have tight pelvic floor or hypertonic pelvic floors. So as I told about the ranges of urine incontinence, so in women में हमको urge आती है when we feel like urinating, we go to the washroom and we kind of go and evacuate. But sometimes there could be a lot of stress incontinence. Stress incontinence in the sense हमारी muscles इतनी weak हैं and we went and ran or we did some wrong workouts. हमने बहुत भारी सामान उठा ली, heavy बाल्टी उठा ली, तब उनको लगेगा कि हाँ मेरी यूरिन लीक हो गई है, या कॉफ किया तो यूरिन लीक हो गई है. अर्ज इनकॉन्टिनेंस में कि बाथरूम पहुंचने के पहले हमें लग रहा है कि वी वांट टू जस्ट पास एंड इट जस्ट निकल जाती है एंड वी हैव नो कंट्रोल ओवर इट. सो इट्स नॉट समथिंग व्हिच इज रॉन्ग इन द बॉडी, इट्स रॉन्ग, इट्स जस्ट अबाउट habitual contraction of those muscles which is not happening in the right parameter. Now, incontinence and pelvic floor physio. So continence and pelvic floor physiotherapy में assessment करना बहुत जरूरी होता है for the bladder pelvic floor dysfunction for these women. And just involuntary loss of the urine or the feces or the urinary bowel urgency, chronic constipation, trouble holding the flatus, getting up at the night more times in a day, they all can be treated with pelvic floor physiotherapy without any medications. And treatment could involve pelvic floor strengthening, bladder retraining, deviation training, voiding training, and prolapse management, along with multifaceted formats of diet, fluid and electrolyte, and lifestyle modifications. तो कई सारी women about the age of 30 to 40 उनके अंदर ये सारी issues आते हैं. Prime issues हम देख रहे हैं आजकल pelvic organ prolapse, constipation, fecal incontinence, pelvic pain. उनमें बहुत सारा pelvic pain रह रहा है आजकल. They always constantly talk about कि मैं बैठे-बैठे I feel a lot of pain in my pubic area. I feel a lot of pain around my pelvic bone. और उनको हर बार ऐसे लगता है कि they're not able to pass urine also. Sometimes they have recurrent UTIs, recurrent urinary tract infections can be linked with damaged pelvic floor, weak pelvic floor, or tight pelvic floor. So ये सारी problem की जड़ कहाँ है? So many of the times women who are pregnant are not exercising the right manner, and आप जो लिखते हैं, like whatever goals you're setting is not just for today, you're setting the goals for 10 years from lifetime. So आप जब pregnant होते हैं तो आपकी exercise capacity decrease नहीं होनी चाहिए, and exercise is not like taboo during the pregnancy. Many times ये women हमको बोलती हैं कि pregnancy में मैं बस rest करूंगी. Now when women is sedentary during the pregnancy, she's already causing a lot of muscle mass loss. She's also causing weakening of the pelvic floor. So the recommended program is that they should embark in aerobic exercise 15 minutes 3 times in a week to 30 minutes 4 times a week, and it can be moderate intensity, perceived exertion. जितना आप बोलते बोलते सांस नहीं फूल रही है उस level तक you got to walk, and also increase some resistance training with bands and little bit amounts of weight 30 minutes a day. पहले के जमाने में the olden times, our grandmothers and everybody, they used to be physically active inside the kitchen in the home, and they were pregnant, they were doing physical work. But the normal age group now between 30 to 40 are very sedentary in nature. They're working online. At the same time, they don't want to exercise because they think they're pregnant, and exercises can cause a lot of issues with pregnancy. There are like range of pregnancies which shouldn't have to exercise, but there are about 80 to 90% of the women should be active during the pregnancy. So what are the exercises which women should be doing during the pregnant time or the reproductive age? For them is the walking, the swimming, stationary cycle, low impact aerobics. Why I called low impact aerobics is जहाँ पे आपका wooden flooring हो, grass flooring हो, not on cement flooring. Why? Because it could cause a lot of bad impact on the pelvic floor. Yoga can be modified so that the positions don't decrease the venous return and doesn't cause hypotension or loss of lower blood pressure. Now, running and jogging and strength training is women-centric and person-centric. Many women being pregnant are also doing jogging and running. There's no taboo around it, but definitely seek advice of a professional physiotherapist and a gynecologist, and then only embark on these exercises. Now, the activities to avoid during pregnancy is high contact sports, which could be soccer and basketball, activities like high risk of falling, like any kind of dancing events, which is high intense, hot yoga and hot Pilates because of the temperature control. But the ground rule is anybody who's pregnant should start exercising to have a pelvic floor which is much better at the age of 40 and 50. Common times between 30 to 40, because women are mostly delivering into the period between 25 to 35 to 40. I'm seeing a lot of women something called as the postpartum pandemic of mummy tummy. So they feel कि postpartum में मेरा tummy big हो गया है. It's normal. It's not normal to have a tummy which looks bloated, and people will call that you still look pregnant if despite having delivered the baby. The common issues with these are that women complain of incontinence, pelvic pain, tailbone pain, and the muscles around the tummy have actually increased the gap. So इससे क्या होता है, सारी women को umbilical hernia के chances बढ़ जाते हैं. Many times we must have heard that a woman is having umbilical hernia. It could be linked to or gone back to time when she might have delivered and might have not taken care of her tummy strength. And iske liye bhi there has to be a proper regime of exercises given by specialized women health physio only, because people think tummy mera fat hai, so they start doing crunches and stuff like that, which is not at all advisable. It's quite risky and will cause a lot of damage. So it's important that before embarking on the exercise, a woman's pelvic floor muscle is assessed, abdominal muscle is assessed, musculoskeletal assessed, bladder and bowel functioning. So we ask the question, how many times in a week are you able to open your bowel, or you're feeling like you're leaking the urine, and return to exercise and goal setting. So most of the women during the postpartum, आजकल इतने सारे YouTube में workouts चल रहे हैं, and people are just embarking on any kind of exercises to lose weight. So the ones which I've marked as cross, these exercises are not to be done But women who have just delivered within the first 1 year, if women have something called as diastasis recti, iske karan women increases about 80% of the times of chances of getting an umbilical hernia or prolapse issue post 40. So women जिन्होंने अपने postpartum phase में exercises गलत ढंग से करी हैं and they have not taken care of their bodies during the postpartum will always end up with issues around the 40 where they feel that the urine incontinence doesn't really get better with any kind of regime for them. So start early and start slow. Seek advice which is more professional in nature. Now, pelvic floor kab humko required it is required in all aspects of the life. I would say that it's required post 30, post delivery, during the delivery, it's required during pregnancy, but it's also required for younger girls. Also, nowadays, I see a lot of younger girls having a lot of issues too. Now, the pelvic floor muscles become weak because of the childbirth, because of the lack of exercise, because of the lack of hormones during the menopause, and also following the pelvic surgery, which could be hysterectomy, bladder surgeries, and all. And many times women जिनको constipation रहता है, जो strain करके अपने bowels को open करने की कोशिश करती हैं, they end up with a very weak pelvic floor. So always address your constipation so that you can avoid the damage done to the pelvic floor. Being overweight and having chronic cough and asthma and COPD, they all have issues with a pelvic floor which is dysfunctional. Now, the pelvic floor muscles are required to strengthen the muscles to help to improve the bladder and bowel and stop the leakage. We will get more details into the topic. So how do we all do it? So if women are listening to me, this exercise has to be done in very thorough consideration under the advice and guidance of a physiotherapist, because if it's done in a wrong way, it can have a very harmful effect on the overall bodily system. The key thing to remember is to relax your body, sit on a chair or a toilet lid, and try to put your body little forward, like stoop a little forward, and the feet has to be on the ground. You can lean forward, and there can be two types of Kegel exercise, which can be a slow twitch and a fast twitch. What do we mean by a slow twitch? So person can lie down on the ground, support the pelvis or the lower part of the hip with 2 to 3 pillows. By doing this, you relieve the pelvic floor from the pressure of any kind of prolapse issue which a woman develops post-delivery, also post the menopause. Now, what they can do is close and draw the muscles from the back passage. Imagine you're trying to pass the wind and it's not passing. Don't allow it to pass. And make sure one is not clenching onto the butt. That is a very important message which I'm giving. A lot of women nowadays, आजकल इतने सारे internet में every kind of celebrity is talking about let's do Kegel, let's do contractions. But what they don't tell is you should not be contracting the buttock muscles. You should not be clenching your tummy muscles so hard, because if you're doing it, you're increasing the pressure system in the already vulnerable pelvic floor. So it is advisable that you do this exercise only under the guidance of a qualified pelvic floor physio who knows the subject matter, who knows how much you should contract, how much one shouldn't contract, because everybody is different. Now, after doing that, also remember to contract the urinary muscles from where you're passing the urine. Imagine that you're stopping the flow of the urine, but don't just kind of jerk yourself and do it by contracting your buttocks and your abdomen muscle. You shouldn't be doing that. Hold on as long as you can. So suppose you're contracting for count of 10, let go for count of 10 to 8. This is called as a slow twitch, which you're doing very slowly. And you can increase the length of the contractions as and when you go. So we can say aim like 2 times, 3 times in a day. You can do while driving your car, while teaching, while studying, while treating people, while working. So there's no time attached to this exercise. You can do any time of the day. Nobody will even understand that you're doing this exercise. But as I've told you, it can be done in any posture, standing, sitting, lying. But those who are doing for the first time, start by doing the posture which I've shown in the picture. You'll be able to isolate the right muscles. You'll understand that you're not contracting your buttock muscles. Now, the fast twitch is you do it in a very fast way. You can sit on a ball, you can sit on a sitting table, or a chair. You can stand on the wall and do it. So what you do is you contract the pelvic floor muscle, hold it for a second, and then relax. So you can do it 5 seconds of 5 to 10 time repetitions of fast contract, fast relax, fast contract, fast relax. So which is holding. Imagine you're stopping the flow of urine. You're holding the wind at the back, contracting your vaginal muscles, and try to hold it for a second and then relax. This can be done in a very slow paced manner also, because these muscles in the pelvic floor have very less blood supply and they get tired very easily. So many women who have weaker pelvic floors from the beginning, they might find it very difficult to do it. And at times, many of these women do it in a very wrong way, because they're always contracting the buttocks, they're not contracting the right muscle groups. So it's important to isolate the right muscle group and then work out these muscles. So use this as a baseline, and you can increase your contractions for 1 to 3 seconds, relax for 3 seconds. So this is a fast twitch which women can do. So anybody who's playing games like badminton, tennis, running marathons around 30 should definitely embark on exercises and do the same exercises while they're running. So incorporate Kegels while running, incorporate Kegels while lifting weights. You will decrease your frequency of having a urine incontinence because of the high pressure built because of the sporting activity. Now, the word of advice, as I said, I have told the do's of Kegel. I'm also telling the don'ts of Kegels. What is the thing is nowadays, Kegel was the word devised by one of the doctors who had said that Kegel is the one lot exercises which every woman should do it. But now the theories have changed and we have updated sciences. Now we say that women who have very tight pelvic floor, very hypertonic pelvic floor, shouldn't do Kegels without thorough advice and checkup by a pelvic floor physio. What are the symptoms of a tight pelvic floor? And somebody has told them, please contract all the time. They may cause more damage to the pelvic floor. A tightened pelvic floor done in a wrong way, women will end up with a lot of low back pain, hip pain, tailbone pain, and they might also have painful sex. And these are the issues which a tight pelvic floor issues can happen. A lot of issues with painful periods are also a sign of hypertonic pelvic floor. Now, in this picture, if you see that the muscle which is the sphincter is kind of contracting, it stops the flow of the opening of the bowels. Now, hypertonic pelvic floor may women will always be constipated because their sphincter muscles are so tight. And if they've done Kegels, as I said, the moment a woman is delivering in India, the common advice which every hospital or every clinic is given to a woman is do a Kegel. Okay, you keep contracting your lower part of the pelvic, keep doing it. Imagine you're stopping the flow of the urine. But the word of advice, the word of caution here is some women need it, some women may not need it. The women of today of 30 to 40 are very sedentary in nature. They're always sitting on some kind of a chair and working online. They will have very tight gluteal muscles or inner muscles, the hip muscles, the hip rotator muscles are super tight for them. A super tight hip rotators will cause these sphincter muscles to tighten further. And in these tightened muscles, if we ask the women to keep contracting, she'll make it further tight, causing the issue of constipation. And as a result of that, you see this motion of pelvis, these muscles have to open up. The sphincter has to open up for the rectum to do the right movement. But if the sphincter is all long, these muscles are tight, the bowel cannot open. So this is the concept which I tell that when I talk about urine incontinence doesn't mean always doing Kegels. It has to be done by relaxation of opposite Kegel. It's called as reverse Kegel. So we were always throwing out this thing to all the women in the childbearing age, do a Kegel. But now I advise do a reverse Kegel also, because you might end up with this complication later on if people have just been following the advice blindly and just been given a random advice that do a Kegel. Now, what is a safe exercise which every woman should do is, I usually talk about the ball-based exercises, which helps to increase your balance increase your abdominal strength, and also increases your core strength and stabilization of your back and your tummy muscles and the hip muscles. And exercises can be done on weight bearing or on the ground. Floor exercises is highly recommended. Squats along with the wall sit-ups, where the women is putting weight on both the legs, is also a good exercise to build the overall strength and the core dynamics for a woman. Now, if a woman has not developed core values or core strength of her pelvic and tummy muscles, and they run with this kind of a weakened pelvic floor, they will always end up with injuring their tummy muscles and pelvic floor. A lot of women have never ran a marathon till the age of 30, 35. All of a sudden, there's a new craze among women that after 40, they start to do Zumba or they want to run marathons. My word of advice to them is until unless you have built your strength, the core, in the rightful manner, if you have not built the dynamics, the core biomechanics of pelvic floor, because sometimes मेरा लेफ्ट साइड का pelvic floor राइट साइड से टाइट हो जाएगा, so it can pull up my uterus in a wrong position, and many of these women will have incontinence while running because their uterus is actually sitting in a bladder at a tilted angle. तो ये जो running, jogging, zumba वाली जो exercises हैं, they also have to be dealt in a very positive way under the supervision of a supervised physio, who will make you understand that any injury which you are having at the pelvic floor can damage further because you're running. So you should do it in a very slow paced manner and a rightful manner. Now coming to the menopause and lifestyle, as I said, women around the menopause or perimenopause will present with night sweat, mood swing, depression, sexual changes, and patients should seek help. And what are the right exercises to be done? Is a bit of aerobic exercises, get to the nature, talk to nature, some kind of walking around the nature, disconnect from the home environment where you have a lot of gadgets and all. Strength training, stretching, stability, and balance. These are the prime exercises which will build the muscle, which will keep and restore the bone strength, prevent osteoporosis. And always it is important that the women should be getting up as often as possible so that weight bearing on the bones happen. And any bone will absorb calcium or will store up calcium in the bone only when we are doing rebounding exercises or we are kind of walking and kind of giving some stress to the bony strength. If we are all sedentary all the time, we are not getting to stand, not doing weight bearing, not doing walking, the bone strength will get very, very hampered. And also is too important is to remember to relax and do some meditation and kind of exercise in a way that your pelvic floor is not getting compromised. As I've already told, try to build the core stabilization. Floor-based exercises are very, very important. Do not encourage to lift very, very heavy weights. So I can talk about my patient who was around 37 to 44, that age group. I see a lot of women, they have some kind of a competition in them that they need to look good, need to look slim. And they end up going to the gym and doing workouts, crazy workouts, which can deplete their natural hormones which the body is producing. And then they get into a cortisol high mode, which will cause them to not sleep right in the night. So between the 37 to 44, many women will say, I need to lose weight. I need to do, like 2 hours of running. I need to lift weights, which are 80 kgs. Remember, the pelvic floor has to be taken care. If you're not doing the right pelvic floor workout, and if you're not using the pelvic floor the right way, we damage the pelvic floor. Secondly, if you are running for 2 or long hours, you have already brought your cortisol to such a high peak because of the fight and the flight syndrome that your estrogen can dominate, and then it affects the insulin levels. And then women we talk about around the menopause are having pre-diabetes or diabetes. So there's so much things about what exercises have to be done, what shouldn't be done for a lot of women over 35. Tweak your hormone and you tweak your workout according to the pelvic floor, abdominal strength, and hormone. There's no competition among women. Women में कोई competition नहीं रहना चाहिए. This is a very important exercise for safe periods. All age group from 30 to 40, even younger women should embark on, whereby they are kind of massaging their pelvic floor and abdominal muscles. It helps to ease up constipation, builds a lot of beautiful pelvic flow of blood and circulation in the uterus and the back muscles. It's a normal Chakri asana. And I talk a lot of core Pilates. So Pilates is not just yoga, its emphasis is on core stabilization, balance, strength, pelvic floor, breath work. So it is an incorporated exercise group, and it is not having two extreme forms of stretching forms as we use in yoga. So why I say that women should not overstretch during the times of age of 30 to 40, because in yogic asanas, we are stretching our ligaments. And many times, as the women approaches 35 and 40, the depletion in the estrogen and will cause the muscle bellies to become very less, or they become very sad. Because of that, they might pull up their joints very easily because of the lack of estrogen. Many of the women post 35 to 40 talk about joint dislocations. They also talk about ligament ruptures. Many of the women during the times of the periods, also because of the high relaxin effect and during ovulation, can dislocate their joints when doing very extreme forms of yoga. So they should incorporate something which is more safer, more balanced in sense, which is more Pilates in nature, which can control your breath, control your pelvic floor strength, and can bring about a good balance in the body types. So these are safe exercises done under a limited angle range of movement. So as I said, the modifiable risk women, for menopausal women, they should embark on walking, being physically active, because we know that during the menopause, the risk of heart disease would increase, and being active is important. Being sedentary is not an answer, but doing the workout in the right way is the prime goal for everyone. So the take-home message is improve the bone health when the women are post 35, because regular exercise will help to soothe all the symptoms which a woman has menopausal, which will help to reduce abdominal fat, which will decrease the incidences of diabetes post-menopause, lower the risk of heart disease, and will cause control of the heart flushes. So a lot of research has already told if a woman is working out during the age of 30 to 40, her menopausal symptoms have come down. And Dr. Anita also has mentioned in the last session about the same thing. A woman can manage her symptoms if she's eating right, if she's exercising well. The only thing which we think now is menopause abhi aa raha hai, because women are not active. They are always sedentary and not eating the right meal. So now we open for questions. Thank you for listening. Yeah.
Thank you, Dr. Anjali. I'm sorry, I've got some repair going on in one of my neighbor's house. Keshavji, you can ask your question, please.
Namaskar, Dr. Anjali. This is very informative and useful session. I thank you for that.
Thank you.
One question comes to my mind regarding Kegel exercise being taken by women. So there are instances of genital prolapse. Can you say up to what stage this Kegel exercise is workable or give fruitful result? And if it is there is any positive result, what is the success rate of that Kegel exercise? Thank you.
So as I told you, every exercise, whether it's Kegels or reverse Kegel, is very person-centric and very patient-centric. So just according unki problem hai, whether it's actually coming because of a very tight pelvic floor, whether it's coming because of the hormonal health of a woman getting depleted, everything has to be taken into consideration. And pelvic floor muscles exercise karne se definitely good results come, because there's a lot of blood circulation and blood flow increase to these organs. But at the same time, as I said, the pelvic floor doesn't work alone. It doesn't work in isolation. Your overall back muscles, your diaphragm, your tummy muscles, they all have to be in good health for your pelvic floor muscles to do the right action and the right work.
Okay.
Thank you.
Thank you.
Dr. If there are others, somebody wants to ask some question, there is a question from, just let me see. Khushbu Kamra. Khushbu Kamra, are you there? She's asking what exercises one should do. What regular exercise is recommended?
Yeah, day-to-day regular exercises, what is recommended in 30s and 40s?
You can actually embark on walking every day, as I said, nature walking, which is connecting with the nature. As I said, we have to think from all three aspects for a woman, which is your hormone health, muscle strength, and also aerobic capacity to improve your blood circulation. So go for a nature walk, at least 20 to 30, 40 minutes of brisk walking, which is important to improve your heart rate and also to improve your blood circulation. And secondly, you can embark on core Pilates, which you can do 3 times or 2 times a week, which will help to improve your core stabilization, abdominal strength, pelvic floor strength. All of them can be done in one exercise group, which is Pilates. Thirdly, you can do meditation, which is very, very important as an important chapter. As I said, a nice, calm mind will be a nice, beautiful hormone for a woman's health, because women are so stressed out that they tighten up their pelvic floor, they tighten up their glute, they tighten up their tummy muscles. उस कारण से उनके अंदर बहुत सारा fatigue और muscle fibromyalgia जैसे pains भी बढ़ जाते हैं. So you got to keep sure that you are walking, exerting your heart to go up, nature walking, connect with nature, and also do your core Pilates, which is very important, and also do meditation. You're going to the gym, if suppose somebody has PCOS and all, do a mixed balance of bit of weight training, a bit of core Pilates, and a good bit of meditation and walking. It should never be that you're just lifting weights and breaking all the muscles in the body, which causes sarcopenia sometimes. What happens is the muscle, it's called as the delayed onset muscle atrophy sometimes, and many women who are going to the gym and working out like crazy with their crash diets, it will deplete the right hormones for the body. So my advice is always do the exercise, not in extremes. You don't need to really look like a model figure. You need to be healthy. That's what my word of advice is. Be fit, but be healthy fit. Thank you.
Thank you.
Dr. Anjali, too much of burping could also be due to tightening of pelvic floor.
Yes, exactly. So कई बार women क्या करती हैं, बोलती है मेरे को बार बार ऊपर से बर्फ आ रहे हैं, right? It is because नीचे का पैसेज आपने इतना टाइट करा हुआ है कि नीचे से गैस ही नहीं जा पा रही है, right? पहले के जमाने में क्या होता था, they were like आराम से, when we say fart, they were farting because the muscles would relax. But अब क्या होता है, they tighten it up. And when does it happen? When women बहुत देर बैठी रहती हैं. They're always sitting in the chair, in the sofa. They don't move about. When you move about, your pelvic floor will naturally open up and the passage or the muscles will open up. So it's very important that the women continuously keeps walking throughout the day rather than continuous sitting. So burping is the biggest reason we say that we have to address the pelvic floor, which could be the tight pelvic floor. Yeah.
Anyone else? Okay. With this, we come to the end of the session. Thank you all. I wish you all a very happy new year. See you on 5th with a new specialist and a new subject. Thank you all. Namaskar.
Thank
Namaskar.
you. Bye.
बंद कर दो रितु. Ritu, close it.